Okay, it's 1 o'clock. We've got a few more people that are joining us, but we've started recording the meeting. So I'm Terry Orr with Childcare Resource Referral, Childcare Consultant on the Decorah office. We're happy that everybody could join us. Fall is here. We're all excited, but of course now new things have changed and happened, and we're excited to have Heidi here to kind of review some guidance for us on some things for health and safety. Just as a reminder, as you put in the chat box, just remember to kind of, put yourself on mute for right now, but we're more than happy to have you ask questions. If you want to put them in the chat box or raise your hand, or if you want to unmute yourself, we're open to that. This is our peer-to-peer meeting for you, and we're excited that you could be a part of this and help contribute to the conversation. So the first thing I'm just going to mention real quickly before Heidi gets started is that if you are working on or need to work on your emergency preparedness plan, there is some new template forms that are on our website. There's one for childcare centers and there's one specifically for childcare homes. They were kind of revised. And along with those templates, which are in different formats for you to download, are some videos to kind of help you through that process in completing those forms. So make sure you kind of check out our website. We're always kind of updating and adding new information. So that's one new piece that we've added. One other thing that I'm going to share quickly is that you probably received an email on Monday from DHS announcing that the rollout of our new quality rating system called IQ4K, that will roll out in April. And we're super excited about that new system. It'll be brand new. Some familiar things on there, but be some changes as well. So look for more information to come. We're excited to see Kaya the kangaroo kind of introduce some new information. You'll be working with your consultants on some of those things as they roll out. Just kind of one little quick highlight, if your expiration falls between now and March 1st, make sure that you are working with your child care consultant to kind of get that information and support you in whatever changes that are rolling out. So with that, I'm going to hand it over to Heidi Hotvedt. She is our child care nurse consultant and works for Healthy Childcare Iowa, and she's going to share lots of great information. So I'll give it to you, Heidi.
Thank you so much, Terry, and welcome to everyone. I'm going to go ahead and share my screen and got a little PowerPoint here. So I just wanted to, here's my contact information. So if you sometimes when you're in these meetings, Zoom meetings or in peer-to-peer meetings, you'll think of something after the fact, maybe a question that comes to mind. So just wanted to share my contact information. So you can email me or call me if you have any questions, and wanted to share that with you. And I really appreciate being able to visit with you today and present some information. And I don't have a lot of slides, so I'm thinking we'll have some time at the end for questions and other topics maybe that could come up. Just want to share our Healthy Childcare Iowa CCNC map and contact information. So my role at Healthy Childcare Iowa, I work for the Iowa Department of Public Health, and I help coordinate the program for our local nurse consultants across the state. And our map and contact information is on our website, and our website is there. It's www.idph.iowa.gov. And then if you either search for Healthy Childcare Iowa, or you can put in the // with HCCI, you'll come to our website. And our consultant tab is where our map is at. And you can click on the map and then scroll down to find the consultant information for your local nurse consultant. So I just have to kind of do a plug for a COVID vaccine. And I know I've shared this slide before, but I just want to really talk about, we have some tools that can help prevent COVID-19, and getting vaccinated is really an important tool to help not only protect you and your family, but really I feel like as adults we have the opportunity to receive the vaccine. And if you and I know you have possibly staff that maybe have had questions, or they're just not sure, or maybe haven't been fully vaccinated, maybe had some, I've heard, some individuals say, well, I got really sick after I got the first vaccine, so I never went back and had the second vaccination. So they weren't fully vaccinated. So I'm just going to tell you that, we have had some increases in COVID-19. Throughout this pandemic, we kind of have these peaks and valleys, and we've had a peak recently. I know as a state, it's starting to plateau a little bit, which is good news. But we really want to protect those that are most vulnerable in our communities from getting seriously ill from COVID. And so we as child care providers, and I say we, although I'm not a provider, I'm a consultant, and I come on site and make visits. And so I think protecting those children that are not able to be vaccinated, those under age 12, is a way for us to be able to kind of protect ourselves and get vaccinated. To find a vaccination location, you can go to the vaccineteiowa.gov website. And then also on that website are some really good helpful information, frequently asked questions. And then there's a link for some other, other resources on that website. And then I did put the website link in for the CDC. They have some really great posters and social media graphics. So any of you who are maybe, working on a newsletter or sending out information to families or whatever, that's a great opportunity to say, hey, have you thought about vaccination? And vaccination is a personal choice, but I just wanted to share that information, that there are a lot of resources out there, and it is a really important tool to help us protect children who are not able to be vaccinated. I get this question a lot, so I thought I would just throw this slide in here. So our current child care guidance from Department of Human Services and Iowa Department of Public Health is still the May 14th, 2021 guidance document. I get this question a lot, so I just thought I'd throw that right out there. It seems like things have changed, and vaccination has been one of them, but really we're still following the same guidance that we had back in May. We haven't really made any changes in the childcare world. I know that a lot of school districts and some of the Department of Ed changes have occurred, but in terms of our childcare guidance, we're still following the May 14th guidance document, and I know CCR&R has that on their website. We have that document on our website, on the Health and Childcare Iowa website, and of course, the Department of Human Services has it on their website. So there's no, we have it everywhere. So if you need to refer to it, please make a copy, and I think just have it handy. I do. I refer to it frequently. And, probably just the general overview of my recommendations from the health perspective is we really need to make sure that we're not having staff and children that are having illness symptoms coming into childcare. And that's not just for COVID-19, but also we've had a lot of RSV this year, this summer. I just talked with someone on the phone where the staff had a sore throat for 2 days, but did still continue to work, was not fully vaccinated, did not have a mask on, and then ended up being positive for COVID. It happens, and we know that. And so it's just really encouraging, that families understand, when kids are ill, they need to stay home, and staff also need to, I think everyone was really good at that at the beginning with that. And I think we've kind of gotten away from it a little bit, and people are like, oh, I just kind of have a little cold, or I think I have this, or, a sore throat, cough, croup. I've heard different things, and then, come to find out it's actually COVID. So just wanted to say that at the beginning. We are still encouraging face covering for those that are unvaccinated, for staff. Parents have the right to be able to make their own decisions about mask use for children. And we want to continue to encourage providers, childcare providers, to allow parents to make that decision. But, that's something that you can evaluate, in your childcare environment. for those unvaccinated staff and then, unvaccinated individuals coming into your environment, that you would ask them to have a face covering. All children younger than 2 years of age should not wear face coverings. And I just had a conversation today about this exact question. And it was, it was a younger child, and the parents wanted the child to have face coverings. And it was actually in another state. I was talking with another program coordinator from another state, and they have that same question that comes up about younger children than 2. So the CDC is very clear about that, and the American Academy of Pediatrics is that they should not be wearing face coverings. In that childcare guidance, it does have a link to the Healthy Childcare Iowa common child illnesses and exclusion criteria, and that's for education as well as for childcare. It now includes COVID-19 and talks about what the exclusion is for those that test positive for COVID.
We do have a question.
Sure.
It says, what are the guidelines now if a daycare parent has COVID?
So, we are following, and I was just going to get to that a little bit. So I might hold off on that one and get through a couple things, and then we'll talk about kind of those exclusions for some additional information. So
sounds good.
Sounds great question. Thank you. So just a couple things, on that childcare common illnesses, definitely we want children to be excluded from childcare or from education setting when the child's illness, so whatever the illness is causing one or more of the following, and that's if it prevents the child from participating comfortably in activities. The need for care is greater than the staff can provide, so that's a big thing. Without, if you're having to do a lot of one-on-one for the one child who's not feeling well, then that really compromises the safety of other children. And then, of course, if there's an acute change in behavior, we always on that common child illness exclusion has always followed the AAP fever definition. So you'll see that's a little different than the fever definition we had at the beginning of COVID, but just so that you're aware that it does follow the AAP's fever definition. And then specifically for COVID, it's 10 days after symptoms start, or if they're asymptomatic, and a lot of children have either mild or are asymptomatic, then it's 10 days after the positive test if there's no symptoms. But it's 10 days after symptoms start and 24 hours without a fever. And of course, without fever reducing medication as well. And then the symptoms improved. And just so you know too, symptoms, that loss of taste and smell can last for quite a few weeks. So if that's the one symptom that hasn't improved, we do acknowledge that, and we would allow them to come back to care. We still are following the CDC list of symptoms, and I just have those down here. And we do know that symptoms appear anywhere between 2 and 14 days after exposure to the virus. So kind of now we're going to talk about a little bit about that question that Terry had brought to my attention in the chat. So the Iowa Department of Public Health has an EPI manual, an epidemiology manual, and that's for all of our reportable diseases. So as we've had childcare programs, when we say, if a child has a communicable disease or an illness, you need to do illness posting, and then there's certain ones that are reportable. So COVID-19 is considered a reportable disease, and so it's included in the manual. And it is really clear in that information that exclude ill children and staff, and to encourage testing. So that's kind of the first thing, is if a child or staff is ill, that we still do encourage testing, and the Test Iowa is available, so you can find out where your closest test area is. Now there's take-home kits that you can pick up from different sites. Public health and some medical clinics have those, and those are free through the Test Iowa. So the COVID-19 is listed under the reportable disease C through D. So if you go on the EPI manual, and I will tell you, this manual, although it is a public document, it's not easy to go through this manual. So I'm just going to say that right off the bat, it's not a user-friendly manual. So that's what your local nurse consultant and I'm available to help with getting through those questions. But I wanted to give you the link and tell you where it's at. So if you wanted to look it up, you could. There's a tab, there's kind of 3 tabs under the COVID-19 section. And one of those tabs is called Controlling Spread. And that's where there's specific information about what you do for controlling spread. So I just want to just kind of talk a little bit about a little bit of information, and this will address that. If a parent is positive. So we say that childcare attendees and childcare providers who test positive, need to follow that standard thing we just talked about, that 10 days, 24 hours, and then symptoms improving. And then if a case for COVID-19 is identified in childcare, then, exposed attendees, can consider staying home in accordance with public health best practices. And that's really on a kind of a case-by-case basis. And I'm just going to be clear about that, is that we always encourage best practice. We would always say that if you were exposed to COVID, that you should follow best practice with public health, and that's the CDC guidelines for when you have an exposure. So that hasn't really changed. And then if you became symptomatic while you're staying home and avoiding being in around other people, then you would, encourage to get tested. But we do know that there is not a requirement, which is a change from before. We had some requirements in terms of exposure, and that's not, the requirement is no longer listed. However, like we said, we always encourage best practice. There is a risk whenever you've had an exposure that you could potentially start having symptoms, and what we, or even asymptomatic. And what we know is it's 2 to 14 days. So you might be feeling great, and then all of a sudden, by the afternoon on the 3rd day, you're not feeling good, and you've been at childcare the whole time, and potentially could have been infecting other people. So just so you are aware, that information is clear in the EPI manual. The other thing the EPI manual does talk about is kind of clusters or outbreaks. So that's a little bit different. So, we've been doing that all along. If you have an outbreak of 3 or more positive cases in a childcare home or center, so that would be not the same household, but 3 or more positives, whether that's staff or children, it doesn't matter. We do have some additional information, and that's where you would definitely want to be talking with your DHS regulatory person, either your licensed staff or your regulatory staff, and letting them know, I have an outbreak. I have, 2 staff and 1 child, or I have, 3 children that are all positive. And then there are some additional, public health may provide some additional guidance around that outbreak. Okay, so it's a little bit different than what we've maybe had in the past. You're always going to, like I said, let DHS know, and then reach out to your local nurse consultant, because they can help provide some additional guidance and work with you on working with local public health, so we know what the best practice would be for your program. Public health may contact you, and I just say may because they may not. Local public health might, be visiting with you, talking with your nurse consultant at the local level, and then the nurse consultant would follow up with you, and the public health might not need to make an additional call to your program. So it just depends on the public health entity. You can always contact your public health office too. So if you have any questions, contact your local public health office and say, I have a COVID question, I have a childcare program, or I'm a childcare home provider, and I have some questions. So they are always a resource. And so one thing that we do talk about a little bit with household contacts, there is information in the EPI manual specific around household contacts. There is a higher risk in a household setting for disease spread. And so there is some guidance around that. So if you have a parent who tests positive, then I would say, reach out to your local nurse consultant, and they can kind of walk through, because every situation is so unique. And it would be really easy for me to say, oh, this is what you should do. But the reality is that every household is different, and every household is unique. And maybe the positive individual is some, an older sibling who hasn't been home all week, or maybe it's a younger sibling, and they, have been maybe staying at grandma's house for a couple days. And so the exposure might, there's all these unique situations. And so that's where I would like you to really, not have just a standard answer, but to refer to the EPI manual and to refer to your local nurse consultant and local public health when there's specific questions around household contacts. I hope that kind of answers it, but I know sometimes that, all those unique situations, but I want to make sure that people understand that.
And there is a question, Heidi. So if a child has a cough, et cetera, and is tested for RSV and COVID, and they both come back negative, can they come back to daycare? So it sounds like maybe this child maybe has symptoms.
That's also remained the same, and the CDC and Iowa Department of Public Health both have said that if you have symptoms of COVID and you get tested and you're negative, then you don't have COVID. So that's why we encourage testing, because if you are having some of those symptoms, that at least get tested and then find out. And then if you're negative, then as long as you're able to participate comfortably, and you're fever free, then you could return to childcare. Good question. Thank you. Any other questions? I don't see any that popped up, but sometimes it's hard for me to see the chat box as I'm talking to. So
not right now, Heidi.
Okay, great. I'm just going to jump to kind of our printed products page. So in the Healthy Childcare Iowa website, when you go on our website, you'll see kind of these tabs on the side, and the childcare nurse consultant tab is where you would see the map and the contact information. And then there's some other tabs, child safety, some of the information about physical activity and screen time. And then some links directly to the Consumer Product Safety Commission and recall notices. The Find Childcare tab links to DHS and to CCR&R for childcare. And then we have our printed products section. And so our printed products is where we have a lot of fact sheets, handouts, posters, things that can be printed and used for your program. In the printed products section, we do have our COVID-19 resource section. So if you are trying to find something and you're not able to locate it, you can go to our site. I tried to do some direct links. The CDC website is very informative, but there's a lot of tabs and a lot of links. So I tried to put the specific ones related to childcare and it linked straight from our resources on the printed products page. And I know that CCR&R has kind of done the same thing. It's like we're trying to get you to the answer you need rather than you can kind of go down the rabbit hole sometimes, I think, when you're on the CDC website, because there's a lot of links and it links you to the next thing, and then pretty soon you can't remember where you're at. So, so we do have some direct links for that. A couple other things I wanted to just share before we kind of open it up to some additional things is we do have a couple new things on our printed products page. So I was just going to talk about those, and then I was actually going to show you a couple of those forms. So we have some new child health exam forms. We have the infant, toddler, preschool child health form, and we have the school age form. And Department of Human Services actually kind of reached out to Healthy Childcare Iowa and said, is there any way that we could work our forms to kind of streamline things a little bit, make things a little bit clearer, easier for providers to be able to access those forms and to be able to have parents not have to fill out duplicated times of they write this in this spot and then they write it, then the parent is having to write the same information in a different spot. And so we just wanted to kind of streamline some things. So over the summer, we worked on some of our health forms, and our child health forms are posted on the website under the printed products page. So you'll see it's a lot different. It used to be a 4-page form for both of those forms, and now they're 2-page. We took off the front page, and I just wanted to share that the front page of the child health forms used to have a lot of contact information. So, parent contact information, doctor, hospital, dentist, and such. And so that page we took off because Department of Human Services already has that enrollment page that I know CCR&R has posted on their site, on their website. And that enrollment page had a lot of the same information. So if you had a parent filling a form out, they'd be filling out the same thing twice. And so we did take that off the child health form. And just so that you know, if you're doing that enrollment form, you do need to make sure that you have both a physician listed and the dentist listed. So even if the family, if the child has never seen the dentist, say an infant or a 1-year-old, and they haven't been to the dentist yet, have the parent write down the family dentist. And the reason for that is if there's a dental emergency, and I'm actually going to share a document in just a minute here. If you had a dental emergency, and that does sometimes happen in childcare, if you contacted the physician, they would refer you to the dentist. So if you have the dentist that family already works with, then you could, if you were waiting, you tried to get a hold of the parent, haven't been able to talk to them, the child had maybe a tooth knocked out, and you don't know what to do, you could call their family dentist office and say, I have, you listed on the contact information that I can contact you on behalf of the family, and I'm waiting for the mom to call back, but this is what happened. What should I do with this tooth, or what should I do in the meantime until the parent can come? And so I get that question a lot. The nurse consultants get that question a lot. Why do they need to have a dentist listed? We want to just make sure they have the family dentist. And then the hospital of choice, that's really, we know in an emergency situation, sometimes the child is brought to the nearest hospital. But occasionally, sometimes if it's not an emergent situation, and say the child has already been seen at a specific hospital, I think of like Dubuque, you've got Family and Mercy. So you really want to know which hospital that family wants their child to be brought to in case of emergency. And that information then would be on that front, like enrollment form. So just wanted to bring that to your attention. The child health forms, we are going to have those in Spanish. They're not there yet, but they will be. And then the physician part of the child health form is that second page. And that's something that would be completed for the physical. The Department of Human Services also asked if we could work on the child care provider physical exam form. That's a required form. So the child health forms are forms that are optional for you to use. And there's, you can, we recommend you use them because they have all the information on there that you need, but that's not a required, those are not required. Those exact forms are not required by Department of Human Services, but the child care physical exam form from DHS is a required form, and that's also been updated, and that's on the website. We do have a few other things that are on the website. Medication administration skills competency, who should take this course. That just provides some guidance in terms of who should take the med skills competency course, and that's on the website. We added a migraine action plan. We're seeing more children in care with migraines, and there is now an action plan related to migraines because there are some medications that sometimes are administered when a child is having a severe migraine. So that has been added to the website. And then the outdoor childhood childcare environments. And I'm gonna actually just, I'm gonna stop sharing for a minute. I'm gonna share a couple other forms here, just so I'll bring that one up. And if anybody has any questions, we could take those right now.
I'm just gonna mention while you're looking for that is just if there's any COVID closures, that's something that CCR&R still is recording, just so we have that data. So yes, if they could make sure to contact their DHS person and CCR&R, and then of course their nurse consultant and public health would be a great resource to kind of help figure out what are the next steps to take and how to clean and inform parents and that whole protocol.
Thanks, Terry.
And Heidi, real quick, sorry, I just wanted to go back to the enrollment forms. To find them on our website, just go to providers, and then if you're a center, go to childcare centers. If you're a home, go to child development homes, and make sure you go under suggested forms, and you'll be able to find it right under suggested forms, not required forms, but suggested. Sometimes there's some confusion there, but it's right at the top, suggested forms.
Great, thank you so much. I just wanted to share, this has been the importance of outdoor childcare environments. This is a great form or kind of fact sheet that we have on our website that was posted a few months ago. But I just wanted to bring it to your attention because there's some great resources on it. This was something that was developed in collaboration with the 5210 program through Iowa Department of Public Health, and then also with the National Program for Playground Safety. And it really talks about, some things about childcare environments. But the other thing I wanted to just on the back page, and I just wanted to bring this to your attention, is there's some great resources. So there's some information on safety. And then at the bottom of the second page, there's some really great websites, but there's some really awesome videos. And it's really about one of them is, or there's two that were developed by NPPS, by National Program for Playground Safety, and they're based right out of UNI, so right in your neighborhood. They have a great program there, and Heather Olson runs that, is the coordinator of that program. They have some great videos, and a couple of them we posted here. One of them's on playground safety, and then one's on proper supervision, which are really great resources. And then the other thing, there's a really neat video on how to do teacher-directed physical activity, and that's a great video too if you have some time and you're looking at what can I do to maybe enhance my outdoor learning environment. And then some websites on there. So I just wanted to share that with you. And then one other, let's see, I had one other form I was going to, let's see, share with you. Sometimes it's hard to find what I'm looking for. Okay, here it is. Can you all see the dental emergencies form? Okay, great. So this is a form that's actually this was developed by iSmile. So I know a lot of you are familiar with the iSmile program, part of the oral health division at Iowa Department of Public Health. And this is a great handout on what to do with dental emergencies. And if you haven't incorporated this into your kind of your policy manual and your practice manual for each of your classrooms, this is just a great tool to have this little handout on dental emergencies and what to do. And it kind of has some different things about what do you do like a broken tooth, or what do you do if there's a knocked out tooth. So I just wanted to bring this to your attention because it is a really great resource to have in your childcare program. So that's all I had for today. So I can just take questions. I'm going to stop sharing. And maybe if you have any questions for me, I know there's a couple local nurse consultants on the line too. I know Kim Gonzalez and Monica Verhelst are on, and I wasn't sure if anybody else was. I can't see my whole screen.
Those were the two that I saw. Yeah, Kim and Monica were on. So yeah, this is a great opportunity for anyone that has questions for Heidi or any of our nurse consultants. I know I'm hearing besides COVID questions, RSV, hand, foot, and mouth, some of those things are popping up. Anything, any general questions that you're getting that you want to address, Heidi, or?
Probably one of the one that we have had a lot of other, and we always have hand, foot, and mouth. We always, unfortunately, have, the RSV season. It just seems like we've had just some unusual increased cases of a lot of diarrheal illness, a lot of hand, foot, and mouth. I know with, many programs reporting, not just one or two children with it, but I had one that I think it was 8 children that had hand, foot, and mouth. RSV has been very severe this year, so I know that we we handle all those. Our nurse consultants get those calls and we direct them to those to the information to the fact sheets that we have. And those are where we refer to the EPI manual, because that's where all of those fact sheets, those are available for us to give to you for posting. But I do know one thing that keeps coming up is about the importance of flu vaccination this year. And, programs, if you haven't had conversation with your staff about flu vaccination yet, I would really highly encourage you to encourage staff to get their flu vaccine this year. There's a lot of questions. Can people get their flu vaccine at the same time as getting their COVID vaccine? And my understanding from the CDC is yes, that can be done. That's the flu, we're concerned that we're going to end up with a lot of flu issues if we don't have good vaccination this year for flu vaccines. So that's, I know the question I've been getting recently is all about flu vaccine and what is some of the predictions, some of the concerns about that. A lot of, the RSV has been very concerning, and not quite sure why we saw such a kind of a late summer RSV season, which is a little unusual. But the problem with RSV, not just the disease itself, it's can be very scary for a parent when their child has RSV. We've had hospitalizations of children with RSV, but the other side of that is a lot of times, and our nurse consultants know this, and you programs know this, is when children come back to care after they've had RSV, a lot of times infants or toddlers, they are prescribed nebulizer treatments. And we are still, nebulizers are an aerosol producing activity, and the CDC is still saying that nebulizers, there's a risk to have nebulizers in childcare. And so that we should be having an inhaler instead with a spacer for children when they return. That's challenging. So I know that we've had a lot of questions about that with RSV, and I would say if you have questions, please talk to your local nurse consultant or contact me, because that is something that we really want to make sure you're safe providing those medications for children. Good question.
Yeah, thanks, Heidi. And ST keeps putting in the chat box, if you haven't noticed, a lot of links for some of the things that Heidi has mentioned. So you can always click those on and kind of save them as your favorites, so you can have reference for those as we go or at a later date. Anybody else have any questions for Heidi? It's a great opportunity to maybe, if there's something that's come up that you're not sure on. I know we have great nurse consultants too that get back to a lot of people, so maybe a lot of your questions have been answered as you go, which is fabulous, and that's what their role is. I know one thing that I kind of heard was a question, and I'm not for sure what the answer was, but I don't know if anybody else's this question is, so if you got symptoms of COVID, at what point do you think you should get tested? Is it, if you run a fever, do you get tested right away? Is there a time frame that you're thinking that maybe if you wait a period of time, you don't want to get a false, negative? What's your response on that?
Usually that's where I think it's reaching out to your healthcare provider to just say, okay, this, I started yesterday with this, today I have this, and then they can kind of walk you through, and say, yes, why don't you come in and get a test? But it's challenging because you could have very mild symptoms and not even know that you're even getting sick. The phone calls I've had recently, it seems like there's been kind of that, I wasn't feeling good for a couple of days, but now I have a fever, and so it just seems like that's kind of been or I've had a sore throat for 2 days, but I didn't really start with a cough until today. So, you don't, sometimes it just takes a little bit of yourself just knowing your own personal health and, is this an allergy type thing, or is it really that I'm feeling sick, or, but I think reaching out to your healthcare provider with those questions, it's important because they also know, your health risks and stuff. The other thing I was gonna, I know a question that I have had come up about, you know, families having questions. I mean, that just, I think it's really challenging, and I feel for parents. We have a lot of, you know, I wouldn't say mixed information, but I know that some of our information does not quite align with the school setting, and that has been challenging for parents, and challenging for you working with your partners, you know, with Department of Ed. But I try to remind parents, you know, children in care are a different age group, and you know, what works in a school environment may not work in a childcare environment. And you all know that, but parents sometimes see that as just kind of the same thing. You know, well, my child can go to school, but now you're saying my child can't go to childcare after school, you know, care. And that's where, you know, it's not that our information is not consistent. It's just that it's a different age group and a different population. And we do know that younger children, you know, for one thing, you know, if they're under the age of 2, they can't wear a mask at all, where in a school setting, you know, they can socially distance. You know, I mean, it's just a different environment. So I know we have that question, and I try to encourage providers to just explain to parents, we understand it seems confusing, or it doesn't seem like it aligns, but that's the reasoning. And then I know a lot of school districts are kind of following different, some are following very strict, you know, best practice guidance from the CDC, and some aren't, and it just, you know, it varies, and that's a personal choice that everybody, you know, every childcare program kind of has the same thing. You know, we always encourage best practice, but it's your decision as a business, you know, what you're going to do. You have to meet the minimum guidelines that DHS has set forward. So perfect. I saw Monica nodding her head because Monica Verhouse, because I know that she has gotten a lot of those questions.
Yeah.
Well, working with our Head Start classrooms that are in the districts, and we're trying to follow the CDC guidances, and then the school is doing it a little bit less, and then they have siblings that are in school and they're in our Head Start classroom. So it's really been a challenge. Some of our parents have been very understanding and some have not. So yeah, it's a challenge.
Anybody else with questions for Heidi or any of our nurses, or just any other questions in general you have? We got a whole captive audience with lots of experts that can help you out.
Yeah, I would love to hear from all of you. You know, what are you seeing that maybe hasn't come to my attention at the state level around, you know, any health and safety topics? We're here to help. And if those are, you know, when I hear of things coming from the field, I bring those to the attention of Iowa Department of Public Health, as well as Department of Human Services. And I know that CCR&R does the same thing, because if you're hearing it, you know, from a couple people, chances are it's happening to more than just a couple programs.
I'm not seeing any right now, but feel free to kind of put it in the chat or raise your hand. Like I said, we've got some time yet. Well, if there's nothing else right now, we might kind of just, I get lots of questions about COVID policies and what to include. Is there a good resource for directing providers to that?
Well, I know the CDC has some great just overview, you know, best practice guidance, but if you haven't been on the Caring for Our Children website lately, they have added a lot of COVID specific policy questions, as well as some guidance in Caring for Our Children. And then I'm just going to do kind of a plug out for California. California's health childcare health program also has come out with some great COVID specific policy and guidelines. Now, California's, you know, the state is a little bit different in terms of how their their guidance for their regulatory body and what requirements they're putting in place. But there's some great guidelines that if you wanted to look at their program, reach out to me, or I could probably put that in the link real quick. I'll put that in the chat. I'll grab that link and put that in the chat.
Okay, perfect.
And I think everybody would be familiar with Caring for Our Children. Is that, that's a resource that's on our Healthy Childcare Iowa website, but I'll also put that link in there too.
Okay. Thanks, Heidi. That was a good question, Sherry. Thank you. Anybody else? So it's nice to kind of have a mix of childcare center directors and home providers on here. So we might just save just a few minutes at the end for childcare center directors. So just about recruitment and staffing. So if you could hang on to that. Anything else? I'll let Heidi kind of add to the chat. And also too, in the chat box, feel free to add anything that you feel that maybe there's something else you'd like to address on a peer-to-peer here, that we're always open to new ideas. Like I said, the intention is these meetings are for you to connect and network, and we really want to make it an opportunity for you to do that. It's not really always our goal that we present information, but that seems the way it goes sometimes with a lot of changes and new information. And we want to make sure that you're informed and have the best resources. So, talk to your consultant or pop it in the chat. We'd love to make sure to address whatever you need to support your program. Well, thanks, Heidi, for putting that in the chat.
I'll also put in the Caring for Our Children link. I'll get that real quick.
Well, if there's no other questions right now, it seems like a quiet crowd. I think everybody's got things to get back to, but I'm just going to bend the ear of our Child Care Center directors for just a few minutes if you want to stay on. I'm going to kind of throw it to Jen Hoddle, our regional training coordinator. I think she's was going to announce a little bit about trainings. So I'll let her do that.
Thanks, Terry. I was just kind of looking at our calendar. September is almost over and our trainings have been kind of in full swing. So we have lots of trainings coming up still in October, November, and even part of December if you need some training hours. We do have quite a bit that's virtual, and we do have a nice amount that's still face-to-face. So if you're looking for trainings, let your consultant know or contact me and I will help you get signed up for some of those. For directors specifically, because I know we have quite a few directors on here, we are offering a face-to-face directors symposium this fall, which is exciting. Limited numbers due to COVID. We are limiting that to 15. It will be socially distanced and you do have to wear a mask at the training. Sarah Bolin is going to do our training for us that day. And it's the Foundations of Understanding Trauma. It's an excellent training. It's 6 hours of training credit that you would receive. We will have a lunch provided, and it is also NAC approved. So if you haven't signed up, it's about half full right now. It's actually in the Independence area. I would have to look up the address, but I believe we're having it at the First United Methodist Church, I believe in Independence. So double check that on the training registry. Send me an email if you need help getting signed up. That would be for directors and assistant directors. We have several statewide trainings that are coming up as well. That would be virtual trainings. We have one tonight that's full at 100 participants, but we do have some coming up in November and offering another one again in December out of this area as well. And so if you have any questions, let me know. Send me an email or give me a call.
Thanks, Jen. Just one other quick thing, and then we'll let you kind of go for the day. The last peer-to-peer training we had for Child Care Center directors, we talked about recruitment and retention, and just wanted to have that opportunity to touch base on that just one more time to see if anyone had some maybe further thoughts on what they've tried that's worked, if they've tried maybe a Facebook post, or if they went to our website and did the Iowa Workforce Development job postings. And we're just really curious to know how things worked, or if you have more questions on that. I know it's still a huge shortage to find staffing in programs. We know it's a huge issue, but it's an opportunity hopefully to talk about it one more time. We'll try and continue that conversation, but we just kind of open that door a little bit right here. If there's any center directors that have anything they found that works, even maybe a little bit of success. It's a quiet crowd today. Has anybody tried the Facebook boost before? I think there was a few of them last time that were going to try that, and maybe they're not on. Not hearing any. Okay, well, I'm sure everybody's busy and has lots on their plate and things they need to get back to. So again, one very tender has not found anything that works, although we raised our starting wage to $9.50. And past employees came back. Well, that's a good success. That's nice to hear. I know it's difficult to raise that, wage. And another one, we've used a Facebook post and it did give us greater numbers, but we still get ghosted. Oh, that's disappointing. So Pam, is the Facebook boost, is that pretty easy to use? Is that pretty user-friendly? And maybe she doesn't have a microphone. If you're not tech savvy, something like that could be a little intimidating, but hopefully that's something that people can try. I suggested to maybe a center director, if you've got some parents that are tech savvy, that would be a great resource, is to go to your parents and have them help you with that. I'm sure there are some of those younger generation parents that would be an easy thing for them to do. So maybe use something like that as a resource. Yes, she said it was easy to use. Yeah. Good. And Jesse did use Facebook Boast in the same, still ghosted, but gave a little bit more hope for applicants. Well, that's hopeful to hear that some of those tips are working. We're hoping that we can continue to kind of give you some more resources, but those are difficult things to find. As a state, definitely is a hot topic. It's something that, is being addressed, but as you know, it's not an easy answer. So hopefully things will get easier. Anything else for questions or comments that you want to share?
I was just gonna ask, we have 5 different sites. We're a pretty big program and we are just really struggling. What is DHS talking about? We hear in our community that places are having to shorten hours. They are having to ask families to not bring their child. This is a problem, and we have not, I'm knocking on wood here, but we have not had to shorten hours or anything like that yet, but we are fearful of going down and what that looks like for our families and our community. What are our next steps and what do we need to do? I don't know, as a community or as directors, or where does our voice need to be heard? Because it's a real problem and it's just getting worse. And our staff are walking out the door because they're burned out, and I don't blame them. And our directors are tired and can't do all the jobs. And then, for us, it's we worry about licensing and we worry about the stuff that we just have to make sure we're keeping kids safe. What do we do with, what do we do? I don't know.
I wish there was an easy answer for that. We encourage you to advocate, talk to your legislators, talk to your community members, and make sure they're hearing that message. They need to hear that loud and clear. We're coming up to a new legislative year, and they have opportunities, hopefully, to make some direction and make some change. The governor's task force had just wrapped up this summer, and I know they've got a list of things that they would like to address. Part of it is tied to funding. So I think your legislators need to hear that message. Get them in the center. Make sure they understand that and hear that loud and clear what your issues are and how drastic it is. I think they need to hear that, you may need to close, you know, hours or rooms or things like that, and how that affects families and how many families that affects. They need to hear from you directly. I think we keep kind of sharing that information, but I think they need to hear it exactly from you, which I know it's hard. I know you've got a lot on your plate, and I empathize with you immensely. This is such a unique time. I've never seen anything like this before. I've been a director in the past for a number of years, and I've never seen the struggles that you've had. So I wish we had better, easier answers, but this is why we bring everybody together to help kind of figure out what is a good problem solution to have. So I don't know if anybody has any other suggestions or thoughts.
The other piece, Liz, I was going to suggest as a parent who is dealing with that currently, and I work for CCR&R though, so I'm very fortunate. But one of the things that we've talked about is making sure that the parents are informed ahead of time of the situation and your concerns and the current climate that you're seeing and what you're anticipating, the same way that you do with your policies, so that it's not hidden. This isn't a hidden conversation, but even down to staff burnout, that this is something that you're seeing, that you're anticipating that could lead to staff burnout. Reason being is because when they leave the center, they're still going to talk. This is going to become a community conversation, which it needs to be. So it doesn't just end with our childcare community, but rather those parents take it to their communities as well, so that we can engage together in unison versus just, you know, those who it affects directly. So I know that's not a great answer, but at least I think if that's possible in some sort of professional way, not to panic, but rather just to inform, that's something that you can do on a micro level with your own program.
Thanks, Esty. That's a good point. I see that Emily also put in there in the chat box the directions on how to do a Facebook post if you want a quick link to that to do that. Anybody else have suggestions or comments? I know we just got a couple minutes left. Not to sidestep the issue. I know it's a big issue, but I don't know if we're going to be able to solve everything in a few minutes. And if anybody has suggestions, if there's a particular area that you want more support in, we have done legislative events in different areas, and that certainly is something that we can help organize and bring your legislators together. We did a Zoom legislative event in one area last year, and I think that went really well, and we recorded it and sent it out to legislators and local partners, and I think they still need to hear that message, and they need to hear what's going on. So we are more than happy to help coordinate anything like that to help kind of get that message out there. So just work with your local consultants and we can help you with those pieces. Anything else? Kim Gonzalez, kudos to all our early childhood providers. I can't say thank you enough. It's been very challenging these last months with so much that's going on in our world. Your dedication to providing healthy and safe environment is appreciated to all. I would totally agree with that. It's just, I think every time one of us steps into a program, we feel like we're walking on eggshells because there's so much that you have going on, and we just can't wait to support you and know that you've got a lot going on. So thank you for all the tremendous work that you're doing for those children. And it's the most valued resource and just the most valued thing that we can offer our community. Anything else? Well, with that, we're approaching 2 o'clock, so I think we're going to stop for now. Again, if you have any questions, don't be afraid to reach out to your consultant or nurse consultant. We're happy to help you in any format, with it's health and safety or finding trainings or helping reach out to your legislators. We will send out this link later for the recording, and we will look to maybe hosting another event like this down the road in another month or 2. Thanks for your time, everybody. Have a good day.
Thank you, everyone. I appreciate your time.